Hello, I'm Dr. Michell Bunny, a female urologist with over 15 years of clinical experience devoted to men's intimacy and well-being. I'm here as a calm, practical voice you can trust, someone who has sat with thousands of men, listened without judgment, and helped them rebuild confidence, comfort, and connection at every stage of life. If you've ever thought, something has changed and I don't feel like myself, this conversation is for you. We're going to bring clarity to what actually matters, remove the shame, and give you a simple plan you can start tonight. Let's begin with a truth I wish every man learned earlier. Intimacy is not a pass-fail exam. It is a coordinated conversation between body, breath, mind, and relationship. When even one of those pieces is tense, rushed, dehydrated, sleep-deprived, or worried, the whole system gets cautious. That caution is not failure. It's your nervous system asking for better conditions. My job is to show you how to create those conditions consistently until your body feels safe to cooperate again. Here is how I frame men's intimacy after decades in the room with real people. There are 4 pillars: circulation, pelvic relaxation, hormone rhythm, and mindset. Circulation means getting steady blood flow to the pelvis through daily movement, strategic hydration, and vascular-friendly habits. Pelvic relaxation means teaching the muscles around the lower abdomen and hips to release, not grip, so signals travel without resistance. Hormone rhythm means protecting sleep, daylight exposure, and protein timing to support the chemistry that underpins mood, desire, and recovery. Mindset means replacing pressure with presence, because performance anxiety quietly activates your body's brakes. When we align these 4 pillars, the system stops fighting itself. Start with circulation. Your blood vessels are living tissue. They respond to routine. A 20 to 30-minute walk most days, at a pace where you can hold a conversation, does more for men's intimacy than most people realize. It improves endothelial function, supports healthy blood pressure, and assists with glucose regulation so your energy doesn't crash at the worst time. Add 5 minutes of brisker walking near the end and then cool down. If you sit long hours, stand every hour for 2 minutes and do 10 slow calf raises and 5 gentle hip circles. Those micro movements prevent pelvic congestion that can build across the day. Hydration belongs to the same pillar. Many men restrict fluids late at night, which can make sense, but they forget to hydrate early. 2 glasses of water before noon, 1 after lunch, and a final light glass with dinner support circulation and comfort. If nighttime trips have been frequent, taper fluids after dinner, but never let your daytime hydration collapse. A thirsty body is not a relaxed body. Now, pelvic relaxation. I've lost count of how many men hold invisible tension across the lower abdomen and in the pelvic floor. That tension can decrease comfort, dampen sensation, and delay arousal. Your first assignment is a daily 2-minute reset I teach every patient. Lie on your back with a pillow beneath your knees. Place 1 hand on your belly and 1 on your chest. Inhale gently through your nose and let your lower hand rise. Exhale slowly through pursed lips and feel your lower hand fall. Aim for a 4-count inhale and a 6-count exhale. This longer exhale signals safety to your nervous system. After 10 breaths, keep lying there and imagine the muscles at the base of your pelvis melting like warm wax. You are not pushing or pulling anything. You are allowing. Do this before bed, before important conversations, and for 1 minute in the bathroom if you feel your body is hesitant to start the stream. Over time, the body learns to release on request. Many men ask whether they should strengthen the pelvic floor. Strength has a place, but timing matters. If a muscle is already overactive and gripping, adding more contraction can worsen the issue. That's why I start with release, breath control, and posture. Once release is easy, we add gentle coordination, slow, draw up, let go motions synchronized with breath, always finishing with a full relaxation. If you ever feel tighter after exercises, you did too much, or you need more time in the relaxation phase. The goal is responsiveness, not constant tension. Next, hormone rhythm. You don't need complicated biohacks. You need daylight, protein, and sleep. Get morning light in your eyes outdoors within an hour of waking for 5 to 10 minutes. This anchors your circadian rhythm. Aim for 25 to 30 grams of protein at breakfast to stabilize energy and set the tone for the day. Choose an earlier, lighter dinner with a clear boundary for screens at least 60 minutes before bed. Protecting sleep is not just about hours, it's about consistency. Go to bed and wake at similar times, even on weekends. Your body thrives on predictability. A steady rhythm supports mood, desire, and physical readiness more reliably than any single supplement. Now, mindset. Anxiety narrows attention and pulls your body towards self-monitoring. When that happens, you stop feeling and start measuring. The solution isn't to deny anxiety. It's to redirect attention to sensory anchors that bring you back to the present. Choose two: breath in the belly, warmth in the hands, or the feeling of your feet on the floor. Practice those anchors during the day so they're familiar in tender moments. When your mind drifts to worries, come back to an anchor. You are training a skill, not passing a test. I want to give you a sequence that ties these pillars into a single evening ritual. Think of it as your 90-minute glide path to a calmer night and a more cooperative body. 3 hours before bed, finish your last larger drink. 2 hours before bed, take a 10 to 15-minute walk at a gentle pace. 90 minutes before bed, dim the lights and do your 2-minute pelvic release breathing. 60 minutes before bed, choose quiet activities, soft conversation, reading, or music. 30 minutes before bed, stretch your hip flexors, stand near a wall, step 1 foot back, soften the back knee, raise your chest gently. Hold 30 seconds per side while breathing slowly. When you enter the bedroom, leave performance at the door. Intimacy lives in slowness. Rushing activates your body's protective reflexes. Slowness tells your nervous system, you are safe. Because this channel is about practical advice, let's talk through common patterns I see and how to respond with skill. If you notice evening urgency and several night awakenings, the first levers are earlier hydration, an earlier dinner, a 10-minute post-dinner walk, and your pelvic release routine before lights out. If your stream is hesitant at the start, do not force the body. Warm your hands under water or rub them together briskly. Then place your palms on your lower abdomen and breathe out longer than you breathe in. Visualize the pelvic floor releasing downward like an elevator. If you wake at 3 a.m., avoid harsh light. Keep your eyes relaxed, walk calmly, breathe slowly, and return to bed with the same belly breath pattern. Your goal is not instant sleep, it is a quiet body. Quiet bodies fall asleep faster. Another pattern is the good morning, anxious evening cycle. Many men feel fine early but get tense after dinner. The fix is a wind down that starts before tension spikes. Put a recurring reminder on your phone for a short walk after dinner. Choose soft instrumental music in the evening. If news or intense shows amplify stress, protect the last hour from those inputs. The best intimacy tool is a regulated nervous system. I've seen that change transform nights. Now let's address supplements and natural supports with sanity. Gentle aids can help, but they should sit on top of the 4 pillars, not replace them. Magnesium glycinate in the evening can assist with relaxation and sleep. Omega-3s support vascular health. A small square of high cocoa dark chocolate earlier in the day provides flavonols that support endothelial function. If you enjoy watermelon or beets, those foods offer nutrients that support circulation. Keep choices simple. More is not better. Consistency is better. Medication questions come up often. Many men worry that asking about side effects will disappoint their clinician. Ask anyway. If something is affecting your comfort, intimacy, mood, or sleep, say it clearly. There are usually alternatives or dose timing adjustments that preserve benefits and improve how you feel. Bring a 1-page list of your medicines and supplements to each appointment. Circle any that changed in the last 3 months and note new symptoms. Patterns become obvious when you see them on 1 page. Testing is another area that requires wise decisions. Screening has benefits at some ages and risk profiles and fewer benefits in others. The most useful question you can ask your clinician If this test finds something, would the treatment change my length or quality of life in a meaningful way for someone my age and health status? Ask for numbers if they are available. You are not being difficult. You are being an informed partner in your care. Well-chosen tests guide smart care. Poorly chosen tests create worry and cascades of procedures that may not help. The difference is a conversation. I want to bring this down to lived experience with 3 brief composite stories drawn from many patients whose details are changed for privacy. Daniel, 58, arrived frustrated. Evenings felt rushed, his mind raced, and he worried he was letting his partner down. We built a glide path, earlier hydration, an after-dinner walk, 30 minutes of low stimulation before bed, and 2 minutes of pelvic release breathing. In 4 weeks, his language shifted from "I'm failing" to "my body is cooperating." His partner noticed his calm. Connection returned without anyone trying harder. He simply created better conditions. Marcus, 66, had long work days at a desk. He stood each hour for 2 minutes, did calf raises, and added hip circles. He protected sleep like a project. He also moved his screens out of the bedroom. The combination reduced evening heaviness in the pelvis. He described it perfectly. "I feel available again." Availability is a nervous system state. He built it. Luis, 72, feared that age had closed the door on intimacy. He started tiny: morning light, a protein breakfast, a 10-minute walk after dinner, and the belly breath ritual before bed. He reframed intimacy as presence, not performance. 10 weeks later, he said, "I didn't get younger, I got steadier." That steadiness is what most men are truly seeking, even when they think they are chasing something else. Let's anticipate and answer a few questions you may have. How fast will you notice change? Some men feel calmer after the first week because the evening routine reduces background tension. Circulatory improvements often show up in 2 to 4 weeks if you're consistent. Sleep quality tends to improve by week 3 when light, timing, and breath are aligned. If your pattern is long-standing, give yourself 3 months. Slow progress that lasts is better than quick results that fade. How do you talk to a partner about this without creating pressure? Share your plan as a well-being routine, not as a performance fix. Say, "I'm building a calmer evening so my body can be more present. I'd love your company on the after-dinner walk." When intimacy begins, keep the focus on connection, not outcomes. Slowness is a strategy, not an accident. If the body hesitates, use your anchors: belly breath, warm hands on the lower abdomen, and gentle patience. Nothing ruins an evening faster than trying to force a timeline. Nothing heals faster than safety. What if you live alone and motivation dips? Tie your walk to something you already do, like closing your computer or washing dishes. Prepare your sleep space before the evening so it invites rest. Cool temperature, dim light, no clutter. Keep a simple tracker by the bed with 4 boxes: walk, hydration, breath, lights down. Check them off. You are giving yourself proof of consistency. Confidence grows from evidence. There are times to seek evaluation, and I want to be clear about them. If you have persistent pelvic pain, burning, blood in the urine, fever, difficulty starting the stream that is worsening, or sudden changes in urinary habits, arrange a prompt visit. If you have ongoing fatigue, low mood, or snoring with daytime sleepiness, let your clinician know. Addressing sleep and mood disorders often unlocks better intimacy. If a treatment plan is not working or has side effects you dislike, speak up. Care should fit you, not the other way around. I'll close with the mindset that has helped more men than any single technique. Treat intimacy as a skill you cultivate, not a gift you lost. Skills respond to environment, practice, and feedback. Your environment is your routine: light, food, movement, and breath. Your practice is small daily repetitions that lower tension and improve circulation. Your feedback is how your body and relationship feel over weeks, not one night. When you adopt that frame, hope returns because progress has a path. You deserve a body that feels like home. You deserve evenings that end with calm and connection. You deserve guidance that is respectful, specific, and free of shame. Take today's plan and choose one action for each pillar: a walk for circulation, 2 minutes of pelvic release for relaxation, morning light for rhythm, and a single anchor for mindset. Do that for 7 days. Then add the next layer. This is how we rebuild confidence, not with pressure, but with steady conditions that your body can trust. Thank you for spending this time with me. I'm Dr. Michell Bunny, and my mission is to help men move from worry to wisdom in their intimate health. If this gave you clarity, carry one sentence into your evening: slow is safe, safe is responsive, and responsive is confident. That is the map. Start with your next breath. Disclaimer: this content is educational and not a substitute for personalized medical care. If you have persistent or concerning symptoms, recent pelvic or abdominal surgery, fever, blood in the urine, significant pain, or sudden changes in urinary habits, seek professional evaluation. Discuss medications, supplements, and tests with your clinician to ensure they fit your health status and goals. Hello, ¿cómo estás?